Well, a new study finds antibody response to COVID-19 is greater if you space doses further apart. Infectious disease specialist Dr. Zain Chagla joins us now with more on this story and lots more. So this was a study done in England, I believe, involving the Pfizer vaccine.
Yeah, so it was about 175 people over the age of 80, so people that already have somewhat compromised immune systems. And so they looked at people who got the traditional 21-day dosing regimen as compared to a 3-month lag after they got their second dose, looked at their antibody levels, and their peak antibody levels were actually higher in the group that got a delayed dose as compared to those who got the 21-day dosing. And biologically, we know this kind of makes sense. It takes a little bit of time for your immune cells to calm down and recover after getting a vaccine. And so potentially, even though we spaced our doses out for resource scarcity to make sure more people have doses, as they need, there may actually be some benefits to this that are emerging. Still early data, but again, this is one of the first studies to suggest actually prolonged dosing might actually be better rather than worse.
Okay, and does this only work, do you think, with the mRNA? So that would be Moderna and Pfizer, those types of vaccines?
Yeah, and actually the evidence for AstraZeneca, even well prior to this, was that delaying the dose was actually the better option. Actually, AstraZeneca encourages people to delay the dose because, again, letting the immune system calm down before they get the second dose actually increases the response from 60% up to 70 to 80% protection.
Now, which shot did you get? Did you get the AstraZeneca?
No, because it was a healthcare worker, the first shot that was available was Pfizer.
Okay. Okay, so I got the AstraZeneca, and I'm hoping to get the second dose of it. But any indication from you, from medical circles, what are we going to do with all these other doses that we're not giving first doses anymore in Ontario of AstraZeneca? What are we going to do with those second shots?
Yeah, I mean, I think they're looking at the data for what happens after the second dose with the clotting risk. And at least what we can see from the United Kingdom, the risk is lower with that second dose, around 1 in a million. But we're just waiting for more data to confirm in multiple settings that's what's been seen. And I think some people will get a second dose of AstraZeneca. Some people may get a second dose of mRNA vaccine, and we had some early indications from the big UK trial that is looking at this right now, that the people that got mixed vaccines actually had a really robust kind of side effect profile. So they had more sore arms, they had more fevers and felt unwell. All of the people did fine. They were just kind of typical vaccine side effects. So that may be the first inkling to say that people may really respond well to a first and second dose by different vaccines as compared to the same vaccine.
Because it's almost like you're getting the best of both worlds then, right?
Mm-hmm. Like they all make the spike protein, but they make slightly different components of it, and they're being triggered in slightly different ways. So, we have a precedent here, right? The way we do pneumonia shots, for example, in people that are high risk, we give one vaccine that has one mechanism, we give another vaccine that has another mechanism, and the additions of the two actually give more protection than giving 2 doses of a single vaccine.
Oh, that's interesting. I didn't know that. I want to talk to you about the flu shot because I heard something. So I know that we only had, 6 recorded cases in all of Canada of the flu last season. But I wonder, does the flu virus that's out there then, because has it had to change at all? So would the flu serum from last year, if they made the same, would it still work this year and work more effectively?
Really good question. I mean, so we get our flu, prediction from what happens in the global south during this during the winter, during our summer, during their winter, right? So we look to Australia in terms of their flu season to predict, okay, what's going to come to Canada during our flu season. The problem is we're not getting many cases even in that setting. They're seeing some respiratory viruses reemerge in Australia, particularly RSV, but they haven't seen a ton of influenza. So, it's really a guess at what actually emerges in that population. But I think obviously we're going to be looking to it to say what kind of flu shots do we need to develop here based on what happens there in the next month or two.
Okay, because the flu shot serum here, is it already being made?
No, we actually base it, again, the production starts based on what happens in Australia in their winter, which is our summer, basically.
Right, right. I'd love to have a half an hour with you just to talk about how different viruses mutate and why they mutate and how quickly they can do it. But we have run out of time. So maybe next week we'll book half an hour aside and chat with you. Until then, have a great weekend. Dr. Zain Chagla, infectious disease specialist.
Take care.